Going now to resuming debate, and the honourable member for Vancouver East.
Thank you, Mr. Speaker. I'll be splitting my time with the member for Salaberry-Surtois. Fundamentally, budgets are about priorities, and what our priorities are speak a lot about who we are, what we stand for, and what we value. This Liberal government was elected on an ambitious platform that promised, quote, real change. And it's been almost a year and a half, and what have we seen? It's post-election, and the rhetoric is still in full flight. But when it comes to matching the action to the rhetoric, unfortunately for many hardworking Canadians, and especially those struggling to make ends meet, Budget 2017 falls short, way short. After studying the budget documents, I would venture to say is that what Budget 2017 really offers to Canadians is a healthy dose of cynicism. Why do I say that, Mr. Speaker? Well, because while the government is making grand statements about promising X millions for the next 5 years for this and Y million for the next 10 years for that, when we look at the details of the budget, you will often see these announcements have no funding attached to them in this fiscal year of 2017-18. In many instances, the money doesn't even flow until the pre-election period for 2019. Most glaringly, Budget 2017 offers many zeros for this budget fiscal year under program spending that would help low-income and middle-class Canadians, while leaving expensive and regressive tax breaks for wealthy CEOs and giveaways to large corporations untouched. Here's a short list of zeros in Budget 2017 for this fiscal year. Working together to tackle homelessness, zero. Improving air quality for Canadians, zero. Targeting housing support for Indigenous peoples not living on reserve, zero. Supporting families through early learning and childcare, zero. Improving Indigenous communities, zero. Accelerating the replacement of coal-generated electricity, zero. Veteran Emergency Fund, zero. Veteran and Family Well-Being Fund, zero. And instead of going after tax loopholes taking advantage of only by the few wealthiest Canadians, the government chose to eliminate the public transit tax credit. From my constituents, Caleb wrote to me saying, I am a constituent in your riding, renting a house with my partner and 3 friends, all of whom work or go to school full-time. I also work full-time as a lawyer. We gave birth to our son in late September, and it has been a wonderful, if challenging, experience. We have been fortunate to have the support of my partner's mother, who is able to assist 2 days a week to give my partner a break and a chance to catch up on the precious little sleep available to new parents. However, come summer, my partner's mother will be leaving the country to spend time with her own ailing father, and my partner will need to get back to her graduate studies. To do this, we anticipate needing at least part-time childcare assistance, and let me tell you, the availability of these services is scant to non-existent. Further to the lack of availability, the cost of even part-time care is likely to reach $1,000 a month, and I'm astounded, given that most of our lawmakers are parents themselves, that such a thin and insufficient system is in place to provide families with young children the support they need to get back to work, contributing to the tax base and to their own well-being. The Prime Minister, Mr. Speaker, was just out self-promoting what a great job he's doing in childcare. Let us be clear. Even though the situation is urgent for families like Caleb, Budget 2017 provides exactly $0 in new funding for childcare spaces. And what's more, future funding for childcare over the next decade is nowhere near adequate to fill the need for childcare spaces. Never mind that childcare costs have raised by more than 8% in the last 2 years and could reach as high as $1,600 a month per child in some cities. Real change, you say? Not. Let's turn to another area. Did you know that Canada is one of the only developed nations with a universal healthcare system that has no pharma care plan, Mr. Speaker? Despite promises of real change, the Liberal government has stuck to Harper's health budget plans, and the meager investment of over 5 years to lower drug costs is completely inadequate. Recent studies have shown that over 8% of Canadian seniors aren't filling prescriptions because of the cost. And it's important to know that this is not a phenomenon only experienced by older Canadians. I have met some of those individuals. Some are cutting their pills in half so that they could, quote, stretch their medication. Others are taking their pills on alternate days. I've met people with diabetes who are not using the strips to regularly check their blood sugar. Why, you may ask? It's because the strips are not covered by pharmacare and they cannot afford to buy them. The lack of universal drug coverage puts the costs of many prescription drugs out of reach for too many Canadians. Marianne wrote to me about someone with Parkinson's who's spending $6,000 a year on drugs. Marianne tells me that, quote, he is now 70 years old and is still working full-time because he feels the cost of the drugs prevents him from being able to retire. At the same time, the stresses from work is contributing to the progress of his disease. It is heartbreaking to watch this, and it's difficult to believe this is happening in Canada, end quote. Mr. Speaker, this is the reality on the ground for people who can't afford their medication. But it doesn't have to be this way. If we ended these tax giveaways to the ultra-rich, we can invest in a national pharmacare program. A national pharmacare program is better for patients, and it keeps people out of the emergency room and long-term care beds. And by the way, the cost of one night in the hospital in BC is approximately $1,500. It's estimated that a national pharmacare program costs $6 billion annually. Can we afford it? You bet. If we choose to reduce the corporate welfare to big corporations with the corporate income tax, we can more than pay for a national pharmacare program. Turning to another key issue, despite grand pronouncements of a new nation-to-nation relationship, the Liberal government has utterly failed to deliver for Canada's Indigenous peoples in Budget 2017. Most pressing are the needs for Indigenous youth. Despite the fact that the House unanimously voted for the NDP motion on child welfare that called for an immediate injection of $155 million to ensure the government complies with a ruling by the Canadian Human Rights Tribunal, just like the Harper administration, this Liberal government continues to discriminate against Indigenous children. Budget 2017 does not provide a dime to address this unacceptable injustice. Dr. Cindy Blackstock made it very clear when she said, quote, there's nothing new in the budget for First Nations children and their families in child welfare or their implementation of Jordan's principle, even though they have been found out of compliance with legal orders to stop that inequality. It's a moral issue. Is Canada so broke that the Finance Minister and the Prime Minister have made a deliberate choice to discriminate against little kids, end quote. Vancouver East is the third largest urban Aboriginal populations in Canada, and we care deeply about the plight of Indigenous, Métis, and Inuit peoples on and off reserves. This comment from Christine in my riding is not atypical. My heart breaks when I think of Aboriginal people who are so desperate that they feel that their only option is to end their own life. As a representative of East Van, I hope you will speak up and urge the governments to send the assistance that is needed now and continue the long overdue work at stabilizing long neglected Aboriginal communities, end quote. On behalf of my constituents, I'm asking this Liberal government why big corporations are allowed to stash almost $40 billion in offshore tax havens so they don't have to pay their fair share of taxes, which results in a loss of $7 billion in taxes each year, and we can't find $155 million so that Indigenous children have the same access to education as non-Indigenous children. What kind of people are we, and what kind of world do we live in? And Mr. Speaker, I'd be remiss if I, as the representative of Van East, didn't touch on the missed opportunity to start a national housing strategy. While the Parliamentary Secretary for Housing promised $20 billion for housing over 10 years during the election campaign, let me point out that the government actually only plans to spend $8.3 billion over the same period, less than half of what they promised. To make matters worse, 90% of that funding won't actually be spent until after the next election. Thousands of Canadians across this country are struggling to find affordable housing, and this is a real problem in my riding. Yet the Liberal government continues to kick the can down the road, making grand promises that are actually contingent on them winning another election. Casey from my riding wrote, "If you don't want to build enough good, safe, community-oriented, integrated, subsidized housing, then why do you keep the CPP and welfare rates so low that we can't afford to live?" A good question, if you ask me, Mr. Speaker.
Questions and comments? Question commentaire. The honourable member for Malpeque.
Thank you, Mr. Speaker. Seeing as no one else was getting up, I will. I listened to the remarks, and having listened to some of the debate today, it is interesting that earlier a member of the NDP got up and talked about the deficits that we're running. The Conservative Party talked about the deficits, and yes, we don't want to run a deficit forever. But this member got up and all she talked about was spend, 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 and I would say that do we not have to recognize in this House that everything isn't done in the budget. The point she made on health care, in fact, we are making progress on the health care issue in terms of the discussions and the agreements that we've developed with the provinces. On seniors' housing, that is part of that agreement where the federal government has targeted money for the housing sector, and where the federal government, rather than giving the money to the provinces for them to spend, has actually targeted that spending must go to mental health. And the last point I would make, Mr. Speaker, on national housing strategy, as chair of the Finance Committee, that is something, and I agree with her, there's a huge concern there that we do need a national housing strategy in this country. But the budget goes some distance. Yes, it's not going to get there in a day, but we lay out a long-term plan in the budget to actually get there in terms of reaching a national housing strategy. Would the member not agree that there is been progress made in this budget for Canadians?
Honourable member for Vancouver East.
Well, thank you very much, Mr. Speaker. The member, of course, misses the point entirely when my colleague, the member from Vancouver Kingsway, raised the issue around the broken promises. That is the point, that this government continually breaks promises. They make these grand promises during the election. They said this is real change, and then after the election, it's like as though it's all forgotten. Election promise after election promise, they break it. That is the reality. Electoral reform comes to mind, and even on the issue around spending, around the deficit, the government, the Liberals promised during the election that they would balance the budget third year running into after the election. But of course, we now know that is not the case. That is the point. Now, in my speech, Mr. Speaker, I raised yes on the issue around spending, urgent spending that is needed now by Canadians. Right now, people who are homeless. If you look at the budget document, page 151, it lists all the many, many zeros, some of which I cited. And why do I say that we need to do the spending now? Because people are desperate. That is the reality. And it wasn't just about spending that I talked about. I talked about where we can find the monies to fund these programs as well that this government refuses to acknowledge. And that is to take the money from the ultra-rich, from the tax breaks and the tax havens, the big corporations that they've been reaping and getting these corporate welfares from this government and the previous government. That's how we can fund these programs.
We have time for one more short question and response. The honourable member, la députée de Salaberry.
The honourable member for Salaberry-Surwa. Thank you, Mr. Speaker, and I'd like to thank my colleague for her speech, which was very clear and very passionate, and she spoke about areas where we need to invest, and I'd also like to hear her thoughts on why we should invest in young people and on how the budget is not investing in the future of young people in our country. We don't really see any investments either for prevention programs, addiction prevention, for example, or anything to deal with preventing sexual violence against women and young girls. So how is it that these young people are being left behind? Also, First Nations young people. These are people who are suffering, and we need to give them every opportunity to succeed and be involved.
Honourable member for Vancouver East.
Thank you very much, Mr. Speaker. I thank my colleague for the question. Indeed, it's rather shocking if you look at budget 2017 and 18 that with the opioid crisis that's going on right now in our communities, right now in my riding, people are dying. This government refuses to acknowledge it by declaring a national health emergency. The Prime Minister came and did his photo op in the riding, to be sure. He came to Vancouver East and did the photo op, and then he left. He left, and then we now see budget 2017 and 18. Where is the emergency funding for this year in this fiscal budget? Zero. There is no money attached to it, Mr. Speaker. I find that absolutely shocking. And why aren't we calling shame on this government? I ask the Liberal members that when you have overdoses in your own riding, what are you doing? Are you calling for your government to put the money where it's needed? And in addition to that, not only about the emergency programs that's needed in place, the government is actually reducing funding for treatment. How is that possible? How is that real? How is that real change?
Good. Before we